All right, folks, let's go to our next story. You know, pragmatic governance is a flexible and adaptive approach to governing that emphasizes practical outcomes between governments and societal actors. Now, we can tell you that Kaduna State government has launched the Kaduna State Emergency Medical Services and Ambulance System. It is known as KADSEMSAS, beg your pardon. Now, the new initiative is designed to deliver rapid, life-saving healthcare across the state. Now, State Governor Sani flagged off the popular exercise at the popular Dora Miller Secretariat Complex, Kaduna. The governor stressed that the historic commitment was to ensure that residents were not denied access to life-saving care during emergencies. That's the way to go. But let's share the story first with you.
Hello.
The launch of the Kaduna State's Emergency Management Service and Ambulance Systems at the Dora Miller Secretariat marks what the government describes as a turning point in healthcare delivery. The system features fully equipped ambulances stationed across the state, a 24-hour emergency and dispatch center, and trained medical personnel. Through the state's rural emergency ambulance and medical services, even remote communities will now have access to life-saving interventions. Governor Sani says for Kaduna residents, healthcare is a right and not a privilege.
This system is more than an emergency response. It is a bridge to equity. It tells our people that when the worst happens, their government is ready, capable, and compassionate. It is a commitment to readiness and resilience. Distinguished ladies and gentlemen, this initiative is not for the privileged few. It is for a farmer in Ikara, a trader in Kachia, the student in Giwa, and the child in Kagarko. No one will be left behind. We are closing the access gap, reducing avoidable deaths, and strengthening public trust in our health system.
The governor also highlighted the implementation of new salary structures for health workers designed to boost morale and motivation.
The key milestone in administration has been the approval and implementation of the 2024 CONMES and CONHES salary structures. This historic move underscores our appreciation for our health workers and our resolve to keep them motivated, fairly compensated, and valued. And I'm happy that all of you here are looking very happy. Maybe if we had done this program last month, we would have been looking different. Today I'm happy that you're all smiling. So that is a show of appreciation, and I'm happy that you are also going to double on our effort to protect life and ensure that we give you our best.
This gesture had last week attracted huge praises from health workers in Kaduna.
We warmly commend His Excellency for approving the implementation of 100% of the revised 2024 Consolidated Medical Salary Structure, popularly known as CONMES, and Consolidated Health Salary Structure, CONHES. The approval of 6,223,540,724.16 kobo annually is an addition to the wage bill for health personnel of the state. This decisive move ends over a decade of stagnation in medical workers' remuneration. It restores dignity to medical practice, strengthens retention, and decisively counters brain drain across our hospitals and health facilities.
On Wednesday, the governor inspected the nearly completed Mando Primary Healthcare Center, one of the 255 primary healthcare centers his administration is upgrading across the state. He interacted with staff and patients, assuring them of improved access to affordable healthcare through additional personnel and modern equipment.
I'm here to see the progress in our primary healthcare center, the one here in Mando. And healthcare for us is very critical because in Kaduna, healthcare is not privilege. It's a fundamental right of our citizens, particularly the poor people, the vulnerable and underserved.
So Kaduna State haven't fulfilled, those things that we're supposed to do, supervision by His Excellency, like this one that he's doing, and some other things. We were awarded as the best in primary healthcare, especially in the northwest region of the country. We hope that with what has happened, that this year, by the grace of God, we'll also be the winners of the challenge. And our hope is that we'll also win the national challenge.
The flag off, he said, represents a covenant with the people of Kaduna State that no one will be left behind in accessing quality health care. Lupe Asom, TVC News, Kaduna.
All right, folks, welcome back. Now, let's take on our next story. Let me tell you, these are not...
No.
Okay.
Okay. Kaduna.
We are not done with the Kaduna story. So let's go back there. Mayor, thinking out of the box, they say is the name of the game. So now some governors, the last time we talked about Akwa Ibom, we talk about inventing tomorrow by creating it.
What I like about this particular program is the next phase of our healthcare system.
Okay.
Because in other climes, in developed climes, ambulance service is an integral part of healthcare delivery.
Delivery, yeah.
When you are ill or there is a challenge at home, you call 911 and you know that an ambulance or a police officer will come to
be at your door.
If you tell them that you have a medical challenge, they will be at your door. It's almost given. So the governor introducing that facility is very good because, yes, it may not be able to go around for now, but at least it's one huge step forward. So that we'll be able to know that because, like I said, ambulance service is an integral part of healthcare delivery.
Okay.
And I'm happy that there's a governor that, yes, like I said earlier, a lot of our governors now, they are forward-looking, they are doing things expected of them. So I'm not really surprised. I'll just commend him for doing that.
Yeah. BK, the other day, Delta governor sacked some health workers, suspended some for, you remember, healthcare delivery for pregnant women and children under 5 are free, but staffers are known to have been extorting these women, these pregnant women and just children. So they were sacked. So if a governor takes to looking at healthcare delivery, that's a big plus.
It is, and Sani, as governor, has been focusing so much on primary health care because a lot of the diseases and ailments killing our people are preventable.
Preventable, yeah.
If you equip the primary health centers sufficiently, people don't need to go to the tertiary and secondary, health facilities just to receive Medicare. There is a need to put doctors, trained medical doctors, not auxiliary nurses alone, put trained doctors in primary health centers. And there should be primary health centers in all the political wards of every state. That is the standard. So he's been really intentional in focusing on those primary health centers so that the quality health care can reach everyone. What the governor has been saying is, look, we are not leaving anybody behind. And these ambulances are being stationed across the length and breadth of the state so that they can deal with emergencies like accidents, complications during childbirth, and other emergencies that naturally would lead to loss of life if you can't bring the people who need Medicare urgently, if you can't bring them to the the closest health facility. So people are already excited seeing these medical teams ready to respond to childbirth complications and other life-threatening situations that had claimed lives in the past. So this scheme is already being taken to the rural areas. You know, the other day he also took delivery of dozens of buses, because they are also going to do what's it called? What Lagos State?
Okay.
This bus rapid transport. Okay. They're also going to do it. Buses have been acquired, and buses, Kaduna is doing its best to reduce the cost of transportation across the city. Because if you take away the money that people spend on transportation, if you reduce it drastically by subsidizing transportation, a lot of our people will be able to get by. It will reduce the rate of inflation. Because if you look at how much it costs people to move around, it's one reason people's salaries can't take them anywhere. Once you set aside food, the cost of feeding the family, cost of transportation, people's salaries usually are almost finished. So the best that government can do is help people take care of some of these expenses. Yes. Help them, subsidize transportation rapidly, subsidize health care services rapidly, because many people give up when, for example, they have to spend so much money on health care. There is a scheme that government has been talking about, which is making cesarean section free, for the women who need it.
That's it.
If we can do it, because I see a lot of people, and I don't know why, maybe because of the kind of food we eat these days, maybe diet has something to do with it. More and more women require assisted birth these days, much more than before.
Much more than before.
You had somebody who tells me, my wife put to bed the other day. Before he finishes the giving you the news, he will tell you that, oh, but she had to do cesarean section, this and it costs a lot of money. It costs a lot. Many people can't afford it. So the government will make it free.
And the cesarean thing, I hear there's a given number of times.
No, you can't. Once you've done it twice, it's too risky to do a third one.
Yeah.
You know, it's too risky to do a third one.
You can do the third one. It's the fourth one that is
like a fourth one.
My younger sister, for example, after the second one,
she
was advised not to. So, and that's why many women can't actually give birth to more children than they want, because if it has to be cesarean,
Mayor, giving birth to more children than necessary will also bring to mind this issue of, if I not get boy, if I never get boy.
No, we are past that stage.
You think?
No, we are past that stage. For example,
who are we?
What I'm saying is that a lot of people do not lay emphasis on male children anymore. For example, I prefer my girls than my boys. I'm closer to my girls.
People come up with this message, this idea. Some of them are unthinking. Because
which boy?
You see, because sometimes the boy gets married and does not look back. Women are far more compassionate.
They won't even look back me.
Women are far more compassionate.
In old age, your daughter comes home regularly.
Yeah, that's the point. You see, people don't. That's why I'm saying some people don't think
deeply.
You see, the prayer is that God should give us good children.
Yeah,
that's what
there should be no basis for
the distribution,
discrimination. Because I've seen, even in my family, I've seen women who take far more interest in the affairs of their parents than the boys.
Of course,
some of the boys who get married, some of the boys who get married, they go abroad and they don't look back. They are busy.
It's not their fault. It's
they are busy with their wives.
We are guilty of the same thing. I remember that when my mom died at 97. When my mom was alive, you understand, until she started staying with me, I would send money to her, but I may not see her in months.
Yeah.
I will just be sending money. I will not have time. I will be saying, Alaja, don't worry, I will see you. I will do that. But my sisters will go there. They will stay with her.
Yes. That's the thing.
That's the thing. Male make peace. So it's better for you to have...
There's a special something the girl child brings.
Take care of you in
the girl child brings a little something special to the table.
Yeah.
Which the boy will
Guys will not have time.
Leave the matter.
Before
they accuse us of preferring one to the other.
We don't drop them. So our next story, you know, pragmatic governance is a flexible and adaptive approach to governing that emphasizes practical outcomes. And so between governments and societal actors, we can tell you that Kaduna State government has launched...
It's not
the story we just took. Okay, let's go now to our next story.